In dentistry, we have not done a very good job about teaching our patients how to floss. So in this segment, we're going to cover how to floss. Other segments are available that talk about why to floss. But to do this, we're going to go to our giant tooth model. One of the things that patients are always concerned about is how to hold the floss. You should use about 18 inches of floss and wrap it around your middle finger or two middle fingers, one on each hand. What this allows you to use your pointer fingers or your thumbs or a combination of the two to guide the floss. In other words, it frees up the fingers that are actually doing most of the work. It's also important not to pop the floss through what we call contacts, because I'm going to show you how not to do it. Don't do it like this, because that might injure the gum, because once you pop through, it produces a lot of force. You want to put the floss at an angle. In other words, instead of like this, or like this, at an angle, and then just guide it through, and then it won't injure the gum. Now once you're through, then the real flossing starts. And what you want to do is wrap the floss around the tooth and slide it up and down the side of the tooth, up and down the side of the tooth. Now for each space, that requires a separate motion. In other words, to get this other tooth in that space, you have to wrap the floss this way and floss it up and down like this. So you're either going on one tooth with a C-shaped piece of floss, or you're going on the other tooth. What you do not try to do is shoe shine it, nor do you try to do two teeth at one time. It's one tooth up and down, the other tooth up and down. And the real key is to allow the floss to go slightly below the gum, because that's the real benefit of flossing, is to floss slightly below the gum. We'll now go to an actual patient to show this. On our volunteer patient model here, I'm not going to floss the back teeth because it's too difficult to show that on the video. But the technique to floss either the front or the back teeth, again, is to not pop it in, but just slide it in, and then once you're in, wrap the floss around one tooth in a C shape, and then slide it up and down, and notice how we're going below the gum. And do this 3 or 4 times until you don't feel the slippery feel of the plaque. Then wrap it around the other tooth and make the same motion. So each contact has 2 teeth, and each tooth has to have a separate motion to get flossed. Flossing is not easy. I want to give you some tips on how to make flossing a lifetime habit. Number 1, you only have to floss once a day. Pick a time when you're doing something else in the bathroom, like shaving or combing your hair. Don't try to floss when you're watching television or walking around the house or at work. Also, start with just 6 teeth and develop the habit. Once you develop the habit, then you can add a tooth or 2 a day until you're flossing all the teeth. But flossing is challenging and it takes some time. So this will get you into the habit. What are some of the things that discourage patients when they try to floss? Number 1 is their gums bleed. Well, this is actually all the more reason you should be flossing. Bleeding gums is caused by plaque. Flossing gets plaque off. So what you'll find is after flossing correctly for a week or 2, your gums do not bleed nearly as badly. And finally, flossing can be very irritating when you get a piece of floss caught between your teeth. This irritates me when I floss. Now I recommend unwaxed floss because it spreads out into little filaments, and each filament flosses separately. But if you do get a piece of floss frayed or caught between your teeth, keep some waxed floss, and the waxed floss is a little stronger, and you can use the waxed floss to get the unwaxed broken floss out. But make flossing a lifetime habit. And now that I've talked about how to floss, I want to say a few things about why to floss.